Good morning, everybody. Today I'm going to talk about oral malodor. I'm Dr. P. Usha from Department of Periodontology. This is about a basic, general, common problem regarding oral malodor, which we regularly encounter day to day. That is nothing but a bad odor or a very bad smell, unpleasant, offensive, distinctive odor. Major role is bacteria. So the breath malodor can be defined as subjective perception after smelling someone's breath. So breath, what are the other names? What are the synonyms of breath malodor? One is oral malodor, fetor exori, fetor oris, and bad or foul breath, which is usually, there are two different mechanisms, because what happens in this is the bacteria releases volatile sulfur compounds because it petrifactions. Halitosis is also known as fetorosis, the stench in the mouth or simply bad breath. These days it is referred as oral malodor. Not only that, but when you eat something which is like garlic or some onions and all, also you too have some blood smell. That is because of the cheese and all the sticky food which you have that stays in the mouth, and putrefaction goes on and leads to malodor. So the basic history of malodor, the problem was first discussed as a length in Swiss Stammend as a Greek and Roman writers. First, a lot of food was given and freshening solutions were given for, like Islamic used to use miswak as an obtained stick for the plant Malodour prisca, clean the teeth and the tongue. Epidemiology, the incident remains poorly documented most of the countries as high as 50% with various degree of intensity. Almost 1 billion of years spent in United Nations, which used to spend money on oral health, oral rinses and mints and related other products to avoid malodor. Then what are the etiology? What is the basic etiology of malodor? Extraoral and intraoral. Intraoral is just because of some periodontal diseases, presence of excessive bacterial reservoirs on the tongue, the deep caries lesions because of the food impaction or extracted wounds filled with blood, then purulent discharges, interdental food impaction, crowding of the teeth, favor food entrapment and accumulation of the debris, acrylic dentures or RPDs which are in the oral cavity, or because of xerostomia. The tongue and tongue coating because of pericoronitis, because of dry socket, ulcerative gingivitis and periodontitis, and some other oral infections. And you can see these periodontal diseases, gingival enlargements, oral lesions and acrylic dentures. In all these you see lot of plaque accumulation which leads to bacterial increased load. Because of that there is release of volatile sulfur compounds leading to oral halitosis. You can see acrotized, necrotizing ulcerative gingivitis, denture stomatitis, carious lesions and even periodontitis with purulent discharge, which leads to oral malodor. And you can see in some amount of coated tongue regions where there is a live bacteria on the tongue leading to oral malodor. So volatile sulfur compounds are the main cause of halitosis. Hydrogen sulfide is one of the volatile sulfur compound and the principal malodorous compound in the physiologic halitosis. So apoptosis plays a major role in onset of progression of periodontitis. The hydrogen sulfide caused apoptosis and DNA damage in human gingival fibroblasts. The increased level of reactive oxygen species stimulates to hydrogen sulfide may include apoptosis and DNA strand breaks. So how does it exactly affect? What is the pathogenesis for oral halitosis is nothing but the bacterial degradation of sulfur containing amino acids with volatile sulfur compounds on the methyl mercaptan and hydrogen sulfide are the major compounds of oral halitosis. These are the volatile sulfur, major key volatile sulfur compounds which lead to oral halitosis. So the extraoral, we discussed about intraoral causes. Now let's talk about extraoral. So systemic diseases like liver failure, kidney failure, diabetes, ear and nose throat infections, bronchi and lung related diseases, GIT disturbances and even hormonal causes also lead to oral halitosis. The metabolic disorders like isolated persistent hypomethormia, fish odor syndrome, few medications like disulfam, dimethyl sulfoxide and cysteamine lead to or a different odor in the oral cavity, whereas some food which is like garlic, onions and all also lead to oral halitosis. So these are the basic elements from where the tonsillitis leads to halitosis, lungs infection leads to oral halitosis, where liver function dysfunction also leads to oral halitosis, diabetes also leads to oral halitosis, lung infections as well as some kidney related issues also leads to halitosis. Pathogenesis of extraoral halitosis. Extraoral blood-borne halitosis was caused by elevated odorous level of dimethyl sulfide in blood and breath. There are some hormonal changes, gastrointestinal changes, renal, metabolic, all these lead to some pathologies leading to oral halitosis. So diabetes and halitosis. How is diabetes affecting halitosis? Blood sugars are kept at healthy level to maintain a healthy diet. Since the body does not create insulin in people with diabetes, eating foods with high in artificial sugars is definitely harmful. When blood sugar is too low or too high, the breath can smell sugary. Because of that, when you see in an oral diabetic patients, the oral odor is rotten apples odor. Okay. And classification of halitosis. Actually, classification of halitosis is physiological and pathological. Physiological is nothing but when you wake up early in the morning and you have some odor in the oral cavity, that is physiologic halitosis, whereas pathologic is due to because of intraoral or extraoral causes. So there is different classifications of halitosis. One is pseudo-halitosis. The pseudo-halitosis is nothing but the patient is underwent or experience, he just feels conscious that he has halitosis. That is pseudo. Whereas halitophobia, when the patient is underwent treatment of halitosis and is completely treated, though still he has that feeling that he exists, he has that halitosis, is halitophobia. Whereas temporary or transitional, that is because of the food which we eat or because of some short-term irregular brushing habits because the patient is not well healthy at particular time, that is temporary or transient halitosis. So how do you diagnose? The main key is to diagnose it properly and then treat it properly. So diagnosis is done in a different, either self-examination. Self-examination, either you lick the breath or your oral cavity, just ask the patient to blow, or you yourself can examine. That is self-examination. Then organoleptic rating and portable volatile sulfur, that is something called halimeter, which diagnoses the typical volatile sulfur compounds. And gas chromatography, dark field phase contrast microscopy. In this, what do? Is you collect saliva or the plaque samples and send it to the lab. They will diagnose the proper microorganisms which are like Prophromona gingivalis or Teponema denticola, which release volatile sulfur compounds, leading to this diagnosis. Saliva incubation test, they collect the saliva in Eppendorf tube and send it to the lab. Based on that, if there are any volatile sulfur, any bacteria present in it, then it is diagnosed in that way. And there is something called electronic nose. This device directly straight away diagnoses oral halitosis. Then how do you rate it? If there is no halitosis or not detected, that is 0. If it is questionable halitosis, a mild odor, then it is 1. Slight halitosis, it's like odor is deemed to exceed threshold, halitosis recognition is done. Moderate halitosis is definitely detected. Whereas 4 is strong halitosis and 5 is severe halitosis. Then this is something, as I mentioned you earlier, this is a halimeter, which is ask the patient to blow. In this way, the proper recording of the volatile sulfur compound is being detected. Then you have volatile sulfur compounds produced by saliva. Sulfur compounds, hydrogen sulfide, short chain fatty acids. These are all the other compounds which causes halitosis in the oral cavity. Then portable sulfide monitor account only 18 to 41% of organoleptic scoring. So this is not an accurate one. So this is a gas chromatography. Digital measure molecular levels of 3 major volatile sulfur compounds, that is hydrogen sulfide, methyl mercaptan and dimethyl. These are the key things which lead to oral halitosis. This is one of the gas chromatography. Then dark field phase contrast microscopy, where you collect the samples of the saliva and then give it. Then there's one more test called Bana test. Then this is the electronic nose, which has been discussed prior. So there is one more coating test, that is tongue coating test. If there is coating, there is no coating, there is no halitosis. Whereas one light coating is present. Whereas 3 presence of distinct coating. Why the coating is primary and important to rule out is because when there is a lot of food accumulation on the coated tongue, there is growth of bacteria on it. Because of that, the bacteria releases volatile sulfur compounds, leading to oral halitosis. Then, as I told you, rotten egg smell is volatile sulfur compound, sweet odor, liver efficient, rotten apple in diabetes patients, and fish odor in kidney and uremia dysfunctions. Treatment. How do you treat oral halitosis? That is, first is mechanical reduction of intraoral nutrients and microorganisms. What do you do in this mechanical reduction? Either you do full mouth disinfection, scaling and root planing, followed by proper brushing techniques. Whereas chemical reduction is nothing but giving a lot of mouthwashes, oral rinses, or some essential oils or some mint flavor, and all this can be given. Rendering malodorous, gaseous, non-volatile, and masking the malodor. So mechanical is tongue cleaning, interdental cleaning, toothbrush, one-stage full mouth disinfection, and chewing gums. Whereas mechanical, this is all the pictures: brushing, tongue cleaning, scraping, and full mouth disinfection. Whereas chemical is chlorhexidine, essential oils, 2-phase, triclosan. All these are anti-plaque agents which reduces the load of the bacteria, leading to no halitosis. When you have other conversion of volatile sulfur, the metal salts, zinc, and all other toothpastes which have zinc content will not let the plaque accumulation to happen. Because of that, there is less bacterial load, leading to the conversion of the masking of the malodor. Whereas masking, how do you do it? Either you have to increase the solubility of malodorous components, so lot of drinking of water or chewing gums and all, or else the saliva by lowering the pH of the saliva. So this is how you all have to basically brush twice a day, use a proper toothbrush, tongue scraping is mandatory, flossing is also mandatory, using mouthwashes once in a while, and eating chewing gums, having lot of citrus fruits along with lot of liquids is very important to maintain your oral hygiene. So proper dental care and oral hygiene leads to proper cleaning along with posterior teeth along with the dorsum of the tongue is mandatory. Rinsing and deep gargling with an effective mouth rinse is mandatory. Eating fibrous food is very much important. Brief chewing gum for the mouth if the mouth is too dry, to make it more and sufficient liquid intake is mandatory. Thank you.